Yeah, just a quick review of the Zuscot long compression arthritis gloves. So these are made specifically for people that have hand arthritis, and they work two specific ways to help decrease the symptoms that come along with hand arthritis. So the first way they work is they provide compression. So compression helps decrease swelling. So if you have any swelling in your fingers or your hand, this will help get that out, and then as you get that swelling out, you're able to move your hand and your finger and the joints a whole lot better. The other way these things work is that they just provide warmth. So as your hand gets warmer, we all know that heat helps arthritis symptoms. So as your hands get warmer, and after a while, if you put them in these, things start to, get a little warmer, heat up, circulation gets better. You can move your fingers a little better, decrease some of the stiffness. So those are the two main ways that arthritis gloves work. So a few points about these particular gloves. These are a little different than a lot of the ones I've been looking at. A lot of them just kind of go up to the wrist area, but I am seeing these now that go all the way up to the elbow and a little bit beyond. So there's a couple reasons you might want to consider buying these particular ones that are long. The first reason is, let's say you have hand arthritis, but your wrist is bothering you, or you maybe have trouble with the elbow. The increased length is really going to help with that. Or if you have swelling in your arm as well, in addition to your hand arthritis, that would be another good reason to get these particular gloves. The other thing I like about these gloves is that they do have the open finger design. So let's say you have trouble, like working, if they covered the whole hand and all the fingers, you wouldn't be able to work your phone very well. Although there are some brands that are full finger arthritis gloves that do work on the phone, so just kind of be aware of that. But with the open finger design, you don't have to worry about using your phone, the touch screens. The other thing is doing activities like sewing or knitting or something like that, or fine motor tasks with your fingers. If they were full finger, you really couldn't do them. But let's say you have trouble knitting or sewing for very long. Now you can put the gloves on, get that pain relief, and continue to sew, and knit and all that kind of stuff because the fingers are open. So I really like those features. So permanent, temporary relief, how do these things work? Well, you put them on, and then after about 30 to 60 minutes, once the compression has done its job, kind of getting out any swelling you might have, your hands, the warmth increases, things get a little more flexible, you're probably feeling pretty good. But after you take them off, probably about 30 to 60 minutes after that, swelling can come back, and, the heat's gone, so you don't have that advantage. But I think there actually is a way to use gloves like this to actually get more permanent long-term relief. Even when you get to take the gloves off. So you're going to need to do a couple things. So we all know the gloves help you while they're on, not so much maybe when they're off, of course. But other thing, what else helps hand arthritis? Well, we know exercise is a proven treatment for hand arthritis. Okay, if your hands are stronger and they're more flexible, you're just going to feel better and they're going to work better. But you can't really do a lot of exercise right now because you have pain, stiffness in your fingers. So what you do is you get some of these gloves and put them on. After about 30, 60 minutes, swelling goes down. If you have any, fingers get more flexible, pain is less, and now you can do exercise. So week by week, as your hands get stronger, more flexible, you're going to get more pain relief even after you take the gloves off. So as an example here, treat your own hand and thumb osteoarthritis. You can consider doing things like some simple range of motion exercises. So if you go to hand therapy or occupational therapy, they always do range of motion exercises. So why is that? Well, one big reason is because the joints in your hand are synovial joints, and they have synovial fluid in them. The synovial fluid brings nutrition to the articular cartilage in the joints. And this synovial fluid gets spread around by you moving your fingers. So let's say you're not moving your fingers as much or as often or through the full range of motion. What'll happen is that synovial fluid really isn't getting distributed as like it should, and so your articular cartilage could suffer. So that's always a good thing to do range of motion exercises. The other big thing to consider is make your hands stronger by doing some strengthening exercises. And here we're just talking about doing strengthening exercises a couple times a week really is enough to strengthen them. Like if you did on a Monday and Thursday or Tuesday and Saturday, twice a week is actually enough to gain a good amount of strength, actually for any muscle group. But this book advocates using a small dumbbell to do some hand exercises on your pinch grip, your finger flexors, that kind of thing. Using just a small dumbbell, 1 or 2 pounds. And then if you need to be stronger, you just buy a 3-pound one and then you can work with that. So therefore you get that progressive resistance, which is really the only way to get stronger. You have to keep adding a little bit of weight here and there. So some people have base of the thumb arthritis, also called carpometacarpal joint arthritis, or CMC joint arthritis. Is there anything you can do about that? Yeah, it's where you have pain just right at the base of your thumb. Actually, there is. There's a muscle called your abductor pollicis longus, and you can see where that sucker inserts right at the base of your thumb, right where you're having all the trouble with. So what you do is you do this one exercise, using a rubber band for resistance. Do that a couple times a week. As your abductor pollicis longus gets stronger, you're going to have more joint stability. And the more stability you get in that joint, the less symptoms you're going to have. Okay, so yeah, there's a lot of things you can do, but hey, you can't do them now. Get the gloves, you're able to put them on, able to do some exercises week by week, get stronger, more flexible. You'll be looking pretty good in about 4 to 6 weeks. So anyway, good gloves. Check them out.